It's just a summary, so stay calm, just keep on listening. This is the brain stem. You have seen is the pons, this is the medulla, and you have been taught about the different nuclei. This is nucleus of spinal tract of trigeminal nerve. This is the tractus solitarius, a main nucleus of general and special visceral afferents, and this is the dorsal nucleus of vagus, and this is nucleus ambiguous. So when they emerge out within the jugular foramen, they have two ganglion. You have this superior ganglion and inferior ganglion. This is the inferior ganglion. So you are seeing here this portion. Actually, I've tried to draw and summarize it for you that this is actually jugular foramen, right? So from this jugular foramen, you are seeing that this ganglion, superior ganglion of vagus, is located within this jugular foramen, and it was having cytons of general somatic afferents coming from the pinna, and this is through auricular branch of vagus Arnold's nerve, and was reaching into the spinal nucleus of trigeminal. And remember, there was a branch from this ganglion, superior ganglion. Here you can see it's the meningeal branch. It is winding back and reaching back into the cranium. This is the meningeal branch, and this meningeal branch was carrying sympathetic fibers and sensory fibers from C1, C2. Got it? Although it's a branch of vagus, but the fibers running in it are different. Then when this nerve emerges out at the base of the skull, you find is another elongated cylindrical nucleus, 2.5 centimeter, right? So this nucleus is the inferior ganglion of the vagus, and this will have cytons of visceral afferents, general visceral and special visceral afferents. So they are small little cytons they have shown. They are the first order pseudo-unipolar neurons, right? So keep on collecting the list of sensory ganglion. DRG was one, trigeminal ganglion was one, geniculate ganglion was one, inferior ganglion of glossopharyngeal, then superior and inferior ganglion of vagus. So these are all sensory ganglion. Okay, so now when it emerges, of course, it will be covered by the carotid sheath in its course, and it will descend down lateral to the internal carotid in its upper part, lateral to the common carotid in the lower part, and it will be medial to the internal jugular within the carotid sheath. Then regarding its branches, now the two branches from the superior ganglion, they have already been given, I told you, and the three branches being given out from this inferior ganglion. So one was this pharyngeal branch. This is the pharyngeal branch of vagus. Pharyngeal branch, remember, superior laryngeal nerve and carotid branch. So pharyngeal branch you are seeing here. This pharyngeal branch will descend down, and remember, it will pierce the carotid sheath, and it will pass between the internal and external carotid arteries, right? So it descends down on the lateral side of the pharynx, crossing the superior constrictor at the upper part of the middle constrictor. It will form a plexus, and this plexus will be having contributions from the ninth nerve as well as from the sympathetic fibers. So that's this plexus. And don't forget that this nucleus, we're talking about this nerve, right? This you are seeing is the pharyngeal branch. We're talking about this nerve, and from where it is coming, it's coming from the nucleus ambiguous, and nucleus ambiguous was stuffed with the efferent fibers which were running into the cranial accessory nerve. So don't forget that from that same nucleus there are two nerves emerging, right? You can see here the two nerves emerging. Cranial portion of accessory, you can see it has joined the vagus now at the level of the important point. Here it's the superior ganglion of vagus. This is the inferior ganglion of vagus. So cranial accessory nerve joins vagus at the level of inferior ganglion of vagus, and then together fibers from the two nerves will run here, and that's why this is called as vago-accessory nerve. So that's why the plexus formed here, the innervation of these pharyngeal muscles will be called vago-accessory complex, right? So all the pharyngeal muscles are innervated by vago-accessory nerve except stylopharyngeus. So that's how you've seen is this pharyngeal branch. Then from superior ganglion there was a branch for the carotid, sinus and carotid body. Actually the branch to the carotid is afferent, so it will carry what general visceral afferent sensations from the carotid body and carotid sinus. B for body, but it is not baroreceptor. Remember, carotid body is chemoreceptor, carotid sinus is baroreceptor. So these sensations will be brought in right through the carotid body, and they will have the cytons in the inferior ganglion, and these sensations will relay into the tractus solitarius. Okay. Then the other branch was superior laryngeal nerve. Look here, this is the superior laryngeal nerve. So the superior laryngeal nerve arising from the inferior ganglion, this actually, pharyngeal branch not only supplies the pharyngeal muscles but also to the soft palate. So it will give a branch to the soft palate as well, and it will supply all the muscles of the soft palate except tensor velli palatini, right? So this will have a very important role in deglutition. Remember this vago-accessory nerve. Then this is the superior laryngeal nerve. This also is carrying fibers from both vago-accessory. That's why two nerves joining here. So vago-accessory nerve. This nerve, the superior laryngeal nerve, will divide into two branches. When will be internal laryngeal and external laryngeal. Internal laryngeal will perforate this. This is thyroid membrane. So let me tell you, out of the two branches from the superior laryngeal, and remember superior laryngeal, its course was perforating the carotid sheath and was running deeper to both the arteries, external and internal carotids, and will divide now into two branches. The internal laryngeal nerve is a thicker branch and external laryngeal nerve is a thinner branch, right? And superior laryngeal nerve was the nerve of fourth pharyngeal arch. So actually this much portion, pharynx wala jo hai, superior laryngeal and pharyngeal branches, they were supplying the muscles derived from the fourth pharyngeal arch. So now this you can see is this internal laryngeal branch, which is thicker branch of the superior laryngeal. This will perforate the thyroid membrane and it will reach inside the upper portion of the larynx and will innervate the mucosal lining up to the upper portion of the vocal folds, right? So there were three cartilages derived from the fourth pharyngeal arch: epiglottis, thyroid, and cuneiform, right? These three cartilages and the mucosa above the vocal folds, they're all being derived from the fourth pharyngeal arch. So internal laryngeal nerve will innervate the mucous lining of the larynx above the vocal folds, and the external laryngeal nerve will descend down and will perforate as well as supply the inferior constrictor muscle, and the external laryngeal nerve will supply the only laryngeal muscle, that is cricothyroid muscle. Okay? So external laryngeal nerve is a thinner division of superior laryngeal, and internal laryngeal nerve is a thicker division, and external laryngeal nerve supplies cricothyroid and inferior constrictor, and ultimately it will end in the pharyngeal plexus. It will participate in the pharyngeal plexus. Okay, then on its course of this vagus, it will give its cardiac branches, right? So vagus on both the sides, these were the branches from the inferior ganglion. Now we're comparing the branches from both the sides. Vagus gives two cardiac branches, right? Superior and inferior cardiac branches from the vagus, from right and left vagus both. But you've been taught about the nerve supply of the heart. So the inferior cardiac branch from the vagus on the left side will reach to the superficial cardiac plexus. The rest of the three, out of these two pairs, superior and inferior cardiac branches from the right and left vagus, the inferior on the left side will reach the superficial cardiac plexus. The remaining three will reach to the deep cardiac plexus. Got it? Then further in its course, remember again, now there's a slight difference among these two cardiac branches and recurrent laryngeal branches. You have to learn them with comparison. As I told you, cardiac branches, there was a difference that the inferior cardiac branch on the left side is reaching to the superficial, rest of them are reaching to the deep cardiac plexus. Similarly, now talking about this recurrent laryngeal now, both the branches from the vagus, but as I told you that vagus is running in the common carotid sheath, right? When it reaches to the base of the neck, this right-sided, I'm talking vagus, gives its recurrent laryngeal branch at the level of the first part of the subclavian. So this nerve, the recurrent laryngeal nerve, on the right side, it descends down anterior to the first part of subclavian, and then it winds back, arches below this subclavian and will ascend up, because it's a recurrent, means it's against to the normal course, it's ascending up back. So it ascends upward and medially to reach in the tracheo-esophageal groove, right? Trachea anteriorly is in the midline, and behind to that is esophagus. So laterally you find is a groove, tracheo-esophageal groove. So within this groove, now this recurrent laryngeal nerve on the right side will run in that groove in very close approximation with the trachea, and of course with the thyroid gland, it will be very close in approximation. Then about the left recurrent laryngeal nerve, mind it like it might be a very hit question that out of the different branches, which of the branches of the vagus nerve is not given out from the head and neck region. So it's the left recurrent laryngeal nerve. Remember, left recurrent laryngeal nerve is given out in the thoracic region, right? Let me tell you before that recurrent laryngeal nerve is very important, is about the vagus. So vagus, because they're content of the carotid sheaths, both the right and left vagus, they'll have to ultimately emerge of the carotid sheath. The right vagus will descend down anterior to the first part of subclavian and will run downward immediately behind the brachiocephalic vessels and will reach on right side of the trachea, descend down on the right of the trachea. Similarly, now in the left vagus, after reaching the lower end of the carotid sheath, it will now pass between the left common carotid and left subclavian. It will descend down because here right side it was branches from the brachiocephalic, on the left side the direct branches of arch of aorta. So the vagus will descend down between the left subclavian and left common carotid and will pass behind the internal jugular and left brachiocephalic vein and will descend down medially to come in line in left lateral relation to the trachea. So both of them, if you see a cross section of the base of the neck, you will find the vagus. How does vagus enters into the thorax? Vagus enters the thorax by passing on either side of the trachea. So that's how they descend down. While before descending down into the thorax, the right vagus has already given out its recurrent laryngeal nerve, but the left vagus, after reaching to the thorax, will now give its recurrent laryngeal branch. So left recurrent laryngeal branch of the vagus is given out in thoracic region. Now this left recurrent laryngeal branch will wind the arch of aorta and will hinge along this ductus arteriosus, right? Because of the ductus arteriosus, so it will hinge around this arch of aorta and will ascend up back recurrent course, and that's why left recurrent laryngeal nerve is a content of superior mediastinum, but not the right recurrent laryngeal nerve. So it will ascend up again, cross this the inlet of thorax, and it will again ascend up on the left side in the tracheo-esophageal groove, and it will be in very close approximation to the thyroid. And both of these recurrent laryngeal nerves will be running in close approximation with the inferior thyroidal artery. Got it? Now look here. This is the superior laryngeal nerve, and superior laryngeal nerve runs along with the superior thyroidal artery while it is away from the thyroid. यहाँ पे thyroid gland will be placed here. So remember thyroidectomy, it's very commonly being asked during thyroidectomy. This superior thyroidal artery is ligated close to the gland, because if you're ligating it away, there are chances of tying up of this external laryngeal nerve. So remember that superior thyroidal artery is in close relation with the external laryngeal nerve away from the gland. It's a little separate, so you can ligate the artery closer to the gland. While here in case of the recurrent laryngeal nerve, you can see is this inferior thyroidal artery, which is very much in close approximation with the recurrent laryngeal nerve close to the gland. So here ligating in case of thyroidectomy, there are very much chances of injuring or ligating to this recurrent laryngeal nerve. So this artery is ligated away from the gland, right? This is the tracheo-esophageal group. This is trachea, esophagus. This is the group both side where this recurrent laryngeal nerve ascends up along with the inferior thyroidal artery. Okay, so right recurrent laryngeal nerve you've seen is arching to the right subclavian artery. That's how its course is. And the recurrent laryngeal nerve of both the sides, they also give cardiac branches, and both the sides, the cardiac branches from the recurrent laryngeal nerve, they reach the
deep cardiac plexus.
Okay, and don't forget this vagus is still running down. It's running down on the right side of the trachea, but trachea terminates at the T4, T5 junction. That is the level of the carina, or the junction of superior and inferior medial sternum, or the sternocmandibular joint. So from there onwards, the vagus will now clinch upon esophagus. So the further course in the thorax, vagus after this T4, T5 junction, up till there was trachea, it was descending along with trachea, tracheal plexus. Now the two vagus will clinch upon esophagus and will form esophageal plexus and will descend along the esophageal wall. And how will it enter into the abdomen? The two vagus will enter the abdomen through which opening in the diaphragm? Through the esophageal openings, right? So that's how the vagus enters the abdominal portion, and there they'll again participate in various plexuses and will provide parasympathetic as well as sensory innervation of the general visceral afferent and general visceral efferents to the viscera. Okay.